Hello and welcome to today's video, guys. I am Dr. Aparajita.roy and today we will talk about the PACES communication station or station 4. This is part 2 of the two-part video series on PACES communication station. If you have not watched the first part, I strongly recommend that you watch video 1 as well in order to get a better grip on PACES communication station. So let's get started. The PACES communication station can be very intimidating for international medical doctors. So when you first start your preparation, you may feel lost in the sea of resources that is available for PACES. So here I am sharing with you 5 exclusive tips that will give you a step-by-step guide on how to maximize your PACES communication station preparation. The first step to master station 4 is to understand the themes. Most of the scenarios that are given in the exam will be based on a central theme. Here is an indicative list of the common themes that often feature in the exam. You may find a scenario where there is a combination of 2 or more themes that have been smartly interlaced in the clinical situation, and it is your job to tease out the hidden bits as you go along. This is not an exhaustive list, and please feel free to add more topics into this list as you go along in your preparation. Now, during my preparation, I took the list of themes a step further, arranged them according to the individual subjects. And I strongly recommend you to try something similar. By doing this, you will not miss out on any topic, especially on the themes of consent for procedures or difficult conversations. Also, this will make you more confident in navigating any topic that may come up in your clinical scenario. Here, I have given you a template, but this is not an all-inclusive list. Again, as I've mentioned, as you go ahead in your preparation, add more themes to this template so that you're rest assured that you're not missing any topic. The next most important tip is to have a rock-solid format. You should not go wrong on this one. Start with a general introduction and then add in any theme-specific element. For a 14-minute interaction, spend at least the initial 2 minutes to set the theme of the conversation. Move on to the body next. It is always a good idea to start with open questions like, how much do you already know? This sets the mood and also allows the surrogate an opportunity to give you information. Now, there is a very specific lesson I have learned during my PACES preparation in my UK course. That is, the communication station is more about active listening than giving information. Do not interrupt the surrogate in the initial few minutes. Remember, they will give you the key information which will form the basis of your discussion. The surrogate have a script, so whatever they are saying is crucial for the station. Next is ICE. Ideas, concerns, expectations. Now, many candidates start this part of the conversation once they reach the 12-minute mark. This is not ideal at all, as the surrogate may have a big list of questions as a part of their script which you may not be able to cover in 2 minutes. And then you will definitely lose marks. Give information in bite-sized pieces throughout your conversation and keep checking the surrogate's understanding as you go along. Depending on your scenario, you may politely ask them to repeat the information that they have just received. Never ever lose your cool. Remember, the script may demand the surrogate to be rude or anxious or irritated or tearful. It is how you tackle that is what you are judged upon. Finally, conclude the session by making follow-up appointments. Remember the thumb rules. Do not interrupt the surrogate and do not rush the conversation. Pause, pause, pause. Even if you think you have not managed to speak about all the points in the stipulated time, do not panic. There is a way around it, and I will come to that in a second. Remember, this is not a station to demonstrate your knowledge. Rather, you are being judged whether you can hold a sensible, meaningful conversation as a doctor. Now, if you have seen part 1 of this video series, you would know I stress a lot on the 5-minute preparatory stage. This is when you should analyze the given scenario with a clear head. What is the theme? Are there multiple themes? Is this a ward or a clinic-based scenario? Who is the surrogate and what is the format that I should use? Note these points in a piece of paper so that in the actual high-pressure situation, once inside the station, you do not miss anything and do not let easy marks slip. Similarly, after your interaction with the surrogate is over, you get 1 minute of reflection time and use this time very smartly. Try to preempt the relevant questions that the examiners are likely to ask you, like DVLA regulations, Mental Health Act, capacity assessments, etc. Also, now would be a good time to mention any points that you could not incorporate in your conversation with the surrogate because of time constraints. If you're liking this video, please give me a thumbs up and consider subscribing to my channel. Also, share this video with other PACES aspirants. The next tip is absolutely exclusive and it is not discussed commonly in any of the courses. This is the hidden agenda in the PACES scenarios. The beauty of the clinical scenario in PACES communication station is that many scenarios may have hidden agendas. They may not be a conventional, straightforward scenarios that is commonly discussed in routine textbooks. As a candidate, you have to unearth that crucial bit of information and make your own management plan around the hidden agenda. Let's look at an example. Here, the candidate is asked to take consent for a water deprivation test from a 50-year-old male. This is fairly simple, right? But if you look at the surrogate information sheet, you would see that there is a twist in the tale. That is, he will not agree to stay for a day-long procedure because of personal commitments. He will divulge this information only if it is explained to him that this procedure will take a whole day to complete. So see, if you have just discussed the pros and cons of the test, you would miss the key bit here and hence be marked as unsatisfactory. Let's look at another example. This is a scenario on hypoglycemia because of a suspected insulin overdose, likely to be a format based on a difficult patient theme as the patient is keen to go home. But delve deeper to see that this patient is not a diabetic and is actually a nurse who has possibly stolen the insulin from the patient's medicine cupboard. So, this scenario actually evolves into the themes of confidentiality and patient autonomy. Now, how do you find out the hidden agenda? The best way is to allow the surrogate to speak uninterruptedly. They have this hidden agenda in their script, and if you ask the right questions, this will definitely come up. Then steer your conversation towards the right direction. The next important bit is catchphrases. Now, it may be our English or the way we communicate, or it's just exam stress that sometimes we may not be able to come up with the right answer or the right words at the right time. So, come prepared with a stock of catchphrases. For example, is this cancer or is this curable? A very common question that may be asked by the surrogate in a breaking bad news session. A good way to answer that would be, I do not think we have enough information to conclude whether this is cancer or not. Cancer is a possibility, but we need to do more investigations to be sure. We will do blood tests to check for any infection that may be treated with antibiotics, and we will also do a camera test, that is bronchoscopy, and a CT scan of your chest. There are different types of lung cancers, some of which may be cured. At this point, we need more information before we can decide whether it is curable or not. Another example can be the surrogate may tell you that I want a second opinion. It is important to acknowledge that patients are entitled to second opinions. You may something in the lines of, like, I understand that you may wish to see another doctor for a second opinion, and that is perfectly acceptable. However, some decisions may be uniform amongst all doctors or healthcare professionals, as mostly we follow a set guidelines. Let me discuss this with my consultant to determine how best we can arrange for a second opinion. Lastly, some theory bits. Although communication station is mostly soft skill based, you still have to familiarize yourself with some ethico-legal guidelines that are commonly followed in the NHS. Now, remember, the common books that we read may have some outdated definitions and guidelines. Make sure you're aware of the most recent updates. Here I have given you a common list of guidelines that are usually asked in the exam. Use this as a guide list and don't hesitate to keep adding to this main list as you go along and learn new topics in your PACES preparation. That's it for today, guys. I hope this two-part video series on PACES communication station has given you important insight into this station. And also please remember, practice, 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 because if you don't practice, no matter how many books you read and how many videos you watch, you won't be able to perform well in the real exam. Thank you for watching this video, guys. I'll see you soon in another awesome video like this. Till then, stay safe, keep studying and ace your MRCP.